Hello, thank you for watching this video, which is an introduction to the General Practice Pharmacy Rules course. My name is Farzana Haq. First of all, I want to give you a brief overview of who I am. I am an experienced clinical pharmacist, an independent prescriber, and founder of Farzana Limited. I have been a registered pharmacist for over 20 years and my career spans over multiple sectors such as community, general practice, hospital, out of hours and remote pharmacy roles. Most of my career I've worked in Scotland. My professional milestones consist of that I graduated with a first class Master of Pharmacy. I've achieved a postgraduate clinical pharmacy diploma with distinction, and I have completed my independent prescribing. My therapeutic area was renal medicine. My current role is that for the last 12 months I have been working as a clinical pharmacist contractor as part of Clinical Pharmacist Solutions for PCNs in England. I'm focused on delivering patient-centred care, conducting structured medication reviews, managing chronic diseases and mentoring pharmacists. So I believe in empowering pharmacists through education on my Instagram as well as my clinical guides to build competence and confidence in general practice. I am also completing a uni degree in coaching and mentoring as well as a college course on nutrition and health. This video is designed to guide you through key areas that will help you understand the role of clinical pharmacists in general practice and how to excel in this field. First, we'll look at the introduction to general practice pharmacy, discussing the evolving role of clinical pharmacists and their impact on patient care. Then we'll move on to the core responsibilities of clinical pharmacists, such as chronic disease management, medication reviews, and contributing to public health initiatives. Next, we'll explore the essential skills and competencies you need to succeed in this role, including communication, leadership, and prescribing. After that, we'll discuss career pathways, how you can transition into general practice, tailor applications, and prepare for interviews. Finally, we'll bring it all together with case studies and practical tips to showcase real-world applications and actionable advice. This webinar is designed to give you a brief overview of general practice, pharmacy, and the role of clinical pharmacists. This supplements the Intro to General Practice Pharmacy course, available through CliniTools on the Revise Pharma platform. I developed this course with valuable contributions from Zia to provide pharmacists with the practical tools, skills, and knowledge needed to excel in general practice. So, firstly, what is a clinical pharmacist? A clinical pharmacist is a highly qualified health professional with specialised expertise in medicines and their optimal use. They work directly with patients as part of the multidisciplinary healthcare teams to enhance medication safety and improve patient outcomes. The NHS defines clinical pharmacists as key members of the general practice team. They focus on medication therapy optimisation, ensuring that medicines are safe, effective and appropriate for each patient. Their work goes beyond prescribing. Clinical pharmacists play a pivotal role in managing long-term conditions like diabetes, hypertension, and asthma. They conduct structured medication reviews to address complex medication needs. They resolve acute prescription queries and support medication reconciliation after hospital discharge. They also bridge the gap between primary and secondary care, ensuring seamless transitions for patients. What sets clinical pharmacists apart is their ability to bring a medicines-focused perspective to patient care. By working closely with GPs, nurses, and other healthcare professionals, they ensure a holistic approach to managing patient health. This slide highlights the key differences between traditional pharmacists. They often work in community or hospital dispensaries or medicines management teams. And then this slide compares them to clinical pharmacists embedded within general practice teams. The transition from an ordinary pharmacist to a clinical pharmacist requires additional training, experience, and skills development, such as independent prescribing, and the the ability to interpret clinical data. However, you can pick up valuable clinical experience in the community, especially if you're trained to deliver pharmacy first services. And all that experience will help you when you apply for general practice roles. As a clinical pharmacist in general practice, your responsibilities are diverse and patient focused. Let's break them down. Firstly, chronic disease management. You have to support conditions such as diabetes, hypertension, asthma, and COPD through medicines optimization and patient education. You carry out medication reviews. You conduct these thorough reviews to ensure medicines are safe, effective, and aligned with guidelines, like NICE. You'll handle acute requests. So these are urgent medication queries efficiently and accurately, and um, issue and approve prescriptions as appropriate. You'll also be involved in public health campaigns, so engaging in initiatives such as vaccination drives and lifestyle counselling to promote health and prevent disease. Medication reviews are different to those you would carry out in the community. A lot of them are going to be structured medication reviews or SMRs. These are comprehensive reviews to optimize medication therapy, minimize side effects, and improve adherence. These responsibilities highlight the pivotal role clinical pharmacists play in enhancing patient outcomes and ensuring medication safety across primary care settings. The role of clinical pharmacists has evolved significantly over the years, becoming an integral part of primary care teams. We get involved in optimizing medication therapy. Clinical pharmacists ensure medications are safe, effective, and appropriate for individual patients. We reduce hospital admissions. By managing long-term conditions and preventing complications, we play a key role in reducing avoidable admissions. We enhance medication safety. Our expertise helps minimize errors and improve overall patient safety. We bridge primary and secondary care. Clinical pharmacists act as a vital link, ensuring seamless transitions for patients moving between care settings. This evolution highlights the growing recognition of our value in improving patient outcomes and supporting multidisciplinary care. Key components of optimizing medication therapy are: 1. Effectiveness. Ensuring the chosen medications achieve their intended therapeutic goals, such as lowering blood pressure or managing blood sugar levels. You need to be able to know, is this medication effective for what it was prescribed for? Okay. Number 2, safety. Identifying and mitigating potential side effects, drug interactions, and contraindications. You will also adjust dosages or switch medications to reduce the risk of adverse outcomes. Then you're looking at appropriateness. This involves verifying that the medication is suitable for the patient's condition and aligns with clinical guidelines like NICE. You've got to avoid overprescribing or unnecessary treatments. Number 4, you're looking at adherence. So you're supporting patients to take medications as prescribed by addressing barriers like complexity, cost, or side effects. You've got to educate patients on the importance of adherence to improve outcomes. Number 5, when carrying out a medication review, you're looking at cost effectiveness. So you're ensuring the use of medications that provide the best value for money without compromising patient care. So, practical example. A patient with poorly controlled asthma might benefit from optimizing their therapy by 1. Assessing their inhaler technique and adherence. Number 2, switching to a combination inhaler if the current regimen isn't effective. Number 3, providing personalized education on the trigger management of the inhaler and proper usage. Optimizing medication therapy is at the heart of what clinical pharmacists do, ensuring patients achieve the best possible outcomes while improving the efficiency of healthcare resources. Let's explore the key differences between PCN pharmacists and practice-based pharmacists. So, a PCN pharmacist works across multiple practices within the primary care network, focuses on population health management, tackling health inequalities, and delivering SMRs for complex patients. They often lead initiatives at a network level, such as implementing prescribing guidelines or addressing specific health targets across practices. While a practice-based pharmacist is embedded within a single GP practice, providing day-to-day patient care. They focus on medication safety, acute prescription requests, and managing long-term conditions. They build closer relationships with the practice team and patients due to their consistent presence in one location. Both roles are essential and complementary, addressing different aspects of patient care in primary care settings. The choice between these roles often depends on your career goals, whether you prefer broader population level work or direct patient interaction in a single practice. This slide covers the core responsibilities of clinical pharmacists in general practice, which are central to improving patient care. So I have already covered what the core responsibilities are earlier on in the video, but as you can see, it's focusing on chronic disease management, acute prescription requests, SMRs, and public health initiatives. To thrive as a clinical pharmacist in general practice and become indispensable to your team, you need to develop a combination of core skills and traits, right? So you need clinical knowledge. So stay up to date with guidelines such as NICE and local protocols, provide evidence-based care and help practices meet cough targets. You need good communication skills, build trust with patients and collaborate effectively with healthcare professionals. Independent prescribing is important. You don't need it at the start, but this skill allows you to take autonomous clinical decisions, improving patient outcomes and reducing GP workloads. You should have technical proficiency, so master systems like System 1 and EMIS to streamline workflows and ensure accurate record keeping. It's good to have good leadership skills, so lead quality improvement projects, audits, and mentoring to demonstrate initiative and drive practice improvements. These attributes will not only enhance your ability to deliver exceptional care, but also establish you as an integral part of the multidisciplinary team. Now, for those of you who don't know what COUGH is, COUGH stands for Quality and Outcomes Framework, QOF. So this is a payment system in general practice in England that rewards healthcare teams for meeting specific quality improvement targets. Okay, so QOF targets focus on measurable outcomes, like managing hypertension or diabetes, and achieving them contributes to both improved patient care and practice funding. Okay, so think of this. Every year, the practice wants to meet QOF points, because if they meet QOF points, that means extra money for the practice, and pharmacists can help with this. Becoming a successful clinical pharmacist in general practice requires a structured pathway that balances practical experience with continuous learning. Let's outline the key steps. Number one, build a strong clinical foundation. Start with experience in hospital or community pharmacy while staying updated with clinical guidelines like NICE and local protocols. Number two, transition to general practice. Leverage transferable skills such as conducting medication reviews and patient counselling to ease into the general practice setting. Number three, enhance your skills. Develop core competencies in chronic disease management, prescribing, and IT systems like System 1 and EMIS. Consider gaining your independent prescribing qualification. Four, tailor applications for general practice. Craft CVs and personal statements that highlight your relevant skills and achievements. Number five, prepare for interviews. Practice scenario-based questions and demonstrate clinical knowledge, communication skills, and a patient-centered approach. Number six, commit to continuous professional development. Engage in webinars, courses, and hands-on workshops. There's courses offered by Clinitools and Farzana especially, and do these to stay competitive. This journey is about continuous growth, building your knowledge, skills, and confidence to thrive as a clinical pharmacist. One of the best ways to prepare for a career in general practice pharmacy is to engage with real life case studies and clinical scenarios. These not only help you develop your practical skills, but also prepare you for the types of questions you might encounter in interviews. So, what common scenarios will you come across in these interviews? Well, you will be asked about how would you manage poorly controlled chronic conditions, such as hypertension or diabetes, where you should identify adherence issues or side effects. They may ask you to conduct structured medication reviews to optimize therapy and improve patient outcomes. Um, can you handle acute prescription requests or reconcile medications after hospital discharge? So, in interview scenarios, you may be asked how you would approach a patient with uncontrolled asthma or one who is on multiple medications and experiencing side effects. Employers want to see your ability to think critically, apply guidelines, and demonstrate a patient-centered approach. I'm proud to share my range of clinical guides available on my Stripe platform. These guides are designed to empower pharmacists with practical evidence-based knowledge to excel in their roles. The available guides are Managing Hypertension, which will offer you practical tools and protocols to optimize blood pressure control, Managing Lipids in Primary Care. So this will go through strategies for effective lipid management and reducing cardiovascular risk. There's also one on reviewing antidepressant therapy, a step-by-step guide to reviewing and optimizing mental health medications. There is a writing good patient notes. So this guide is provides lots of tips for clear, accurate, and legally sound documentation. I also have a managing thyroid conditions guide, which is a comprehensive guide to diagnosing, monitoring, and managing thyroid disorders, including practical tips for general practice pharmacies. What sets these guides apart are that they are concise, actionable, and rooted in clinical practice. They're perfect for pharmacists transitioning to already working in general practice. They include tools, templates, and case-based examples to apply learning directly. Follow me on my Instagram account, which is Farzana, and there is a link on the Farzana profile to my link tree, which has all the links to purchase any of these guides. Okay, thank you so much for joining me today. I hope you found this video valuable in providing insights into general practice pharmacy, and it inspired you to take the next steps in your career. Remember, you can also connect with me directly via my Instagram account on Pharmazana. Your journey to becoming a confident and competent clinical pharmacist starts here, and I'm excited to be a part of it. Thank you again, and I look forward to connecting with you.